Check this on. Good afternoon, everyone, and welcome to today's wonderful afternoon with Dr. Murali Bharadwaj. And last time we started the PYQ single liners, and we'll try to continue. Good to see two online classmates. Just ask Mary to post everywhere. Now, chemotherapy-induced thrombocytopenia. So what do we give, doctor? We give oprelapkin, which is the interleukin-11, which can be used. It's a recombinant form. It will go and stimulate the megakaryocytic population and increase the platelet count. Now, if you look at interleukin-11, it has a lot of functions. One of that is to stimulate the JAK-STAT proteins, which are involved in angiogenesis, migration, proliferation, differentiation, invasion, survival. So JAK-STAT is also involved in polycythemia rubra vera, where the bone marrow becomes totally independent and start producing the RBCs without the need of erythropoietin. So what is the difference between polycythemia rubra vera versus secondary polycythemia? Whenever you have hypoxia, like bad lungs, or whenever you have cyanosis, like congenital heart disease, or whenever you are having any chronic kidney disease, or whenever you are there in the high altitude, in all these scenarios, erythropoietin production will reflexly increase in response to alveolar hypoxia. That will go and stimulate RBC production, leading to polycythemia is a primary polycythemia. Whenever the hypoxia due to high altitude, or congenital heart disease with cyanosis, or bad lungs like COPD, they lead to erythropoietin increase, and leading to polycythemia is secondary polycythemia. Without any hypoxia, because of the JAK-STAT mutation, if the bone marrow is overproducing the erythroid precursors, then we call polycythemia rubra vera. There the erythropoietin gets suppressed because high hemoglobin will suppress the erythropoietin. So low erythropoietin with polycythemia is equal to rubra vera. High erythropoietin plus polycythemia is equal to all hypoxic conditions like COPD, congenital heart disease, which is cyanotic, or in case of bad lungs like COPD. So this is what we need to remember. So interleukin-11 is oprelapkin injection. So this comes as a brand called Numega, Pfizer, oprelapkin. Lot of chemotherapies may platelet count will fall down. So in such people, to stimulate the megakaryocytes, we give the interleukin-11. The second type of situation is those who undergo chemotherapy. In them, the granulocytes and granulocyte monocytes, they will fall down. Neutropenia will come. To treat that, we give two drugs. One is granulocyte colony stimulating factor. Other is called granulocyte monocyte colony stimulating factor to stimulate the granulocytes, precursors in the bone marrow, whenever the patient is undergoing chemotherapy. And what is that called as? Filgrastim, sargomastine. Filgrastim, sargomastine are the GCSF and GM-CSF congeners, which stimulate the bone marrow to produce the WBCs. Whenever chemotherapy causes the suppression, myelosuppression is what you need to basically remember. Very nice to see Dr. Praveen, Sajjan, Dr. Rajshekhar and many more. Can you please punch his voice loud and clear, doctor? So every Monday and Sunday, we have a full-scale grand test and discussion. And the remaining days, we will have 10,000 PYQs revised. So that is the plan. If we stick to this rule, automatically you will get the top rank. Now, doctor, losartan acts like a thromboxane A2 antagonist and prevent the platelet aggregation. All of you know, losartan is an angiotensin receptor blocker which is used to treat the hypertension. The same losartan also has a function of thromboxane A2 and inhibit the platelet aggregation is what we need to remember. Carpal tunnel syndrome. Typically, we use Durkan's test. So what is Durkan's? It involves direct compression on the carpal tunnel for about 30 seconds. And then it will lead to the pain of median nerve. How is the median nerve pain? Thumb, index finger and middle fingers half. And the remaining is all ulnar. So, Durkan's test has a high sensitivity more than Tinel's and Phelan's. So, what is Phelan? Wrist flexion, and Tinel is tapping over the course of the median nerve also will be very painful. That is called Tinel's sign. And often we use nerve conduction studies. Ultrasound can clearly show the carpal tunnel leading to compression of the median nerve. So this is Phelan's test. What is this, doctor? It is Phelan's test. Then this is Tinel's sign. Now, CAP classification is used to grade the varicose veins. Eczema over varicose vein corresponds to stage C4A in the CAP classification. So stage C4A include eczema pigmentation with chronic venous insufficiency. C4B is lipodermatosclerosis and atrophy blanche, which is the advanced classification. So yesterday I have given what is the clinical classification CEAP. Because the 2023 NEETPG this question came, we need to by heart. Once more it will come. Because veins is day in and day out affair. Today, since morning, at least 5 cases I might have seen in the OP who had varicose veins. Understand? Very common. Angiography is the next best step in managing patient of subarachnoid hemorrhage. Fundamentally, subarachnoid hemorrhage commonly is because of the aneurysm in pica, posterior inferior cerebellar artery, which connects the posterior cerebellar artery with the internal carotid, part of the posterior circulation. I told circle of Willis, two vertebrals combine to form basilar artery, which will become PCA. PCA will connect with the internal carotid artery through pica, and internal carotid artery also gives rise to MCA and ACA, and the two ACAs are connected by anterior communicating artery is what we need to remember. So whenever the aneurysm is causing the bleeding, typically anterior communicating artery, whenever it has grown and leading to bleeding, we need to, as an interventional radiologist, tomorrow you will be going there and putting a clip, right? So aneurysmal clipping, endovascular coiling is the one which you will plan. And whenever subarachnoid hemorrhage is there, rebleeding chances are very high. And what is the triple H therapy in subarachnoid hemorrhage? H, control the hypertension. H, provide a lot of fluid. Hypervolemia you need to create. H, create hemodilution. So control the hypertension, make the patient get hypervolemic, create hemodilution so that you can prevent the vasospasm. See, you can see here, this is the subarachnoid hemorrhage aneurysm. Can you appreciate aneurysm? Aneurysm में जाके आपने क्या coil लगाते और clipping करते so that you will obliterate the aneurysm. If it ruptures, that leads to subarachnoid bleed into the subarachnoid space, which is there between arachnoid and pia mater. Now, typically, when will you get a hemiplegia or any focal neurological deficits? If the bleed is there in the cerebral parenchyma, intradural, intracerebral hemorrhage. But subarachnoid is on the cerebral hemisphere, you are already having pia mater. On the top of it, you are having the bleed between arachnoid and pia mater. So there is no reason to get any focal neurological deficits because the bleed is outside. But still you can get it. How? The blood vessel supplying the brain will pass through the subarachnoid space. When the bleed surrounding that lead to irritation and lead to vasospasm, then that decreases blood flow and lead to hemiplegia. So the whole goal of subarachnoid hemorrhage management is how do you avoid vasospasm? For that, control the hypertension, hydrate the patient, giving fluids. And we give nimodipine, calcium channel blocker, which is called nimodipine, in order to relax the blood vessel. So these are the things that we do in order to prevent vasospasm in case of subarachnoid hemorrhage. Sodium hydroxide injection was done, which is a caustic alkali. It causes severe chemical burns. So you need to treat them with feeding jejunostomy. So esophagus becomes stomach, stomach becomes duodenum, duodenum becomes jejunum, jejunum becomes ileum. So directly feed into jejunum. So you will put one feeding gas jejunostomy tube in order to manage the dysphagia caused by the alkaline burn is what we need to remember. And any chronic alkali associated injury to the esophagus lead to esophageal cancer risk will increase. And all that stricture need to be dilated down the line. So what you are seeing here, there is a esophageal stricture which is caused by the alkali congestion, ingestion. A midline neck swelling that moves with deglutition and tongue protrusion is thyroglossal cyst. So thyroglossal cyst typically is a midline swelling. It moves with deglutition whenever the tongue is being protruded. Why? Because it arises from the thyroglossal duct embryologically, which has a connection with the tongue. So what is the most common location for thyroglossal cyst? Hyoid bone के नीचे होता, not above that or on that. Subhyoid, below the hyoid, along the midline is the most common location. The most common congenital neck mass, thyroglossal cyst. And it can become infected. It can lead to pain, redness, swelling. And what we do to treat that? Cyst trunk operation, where we do the excision of the cyst along with the central hyoid bone to prevent the recurrence. Rarely it can lead to papillary thyroid cancer can arise from the thyroglossal cyst. So what you can see here, doctor, this is the thyrohyoid muscle, right? This is the omohyoid muscle superior belly. This is the sternohyoid muscle. So this is the place where you are having hyoid bone, and below the hyoid is the most common location for the thyroglossal cyst, which has a connection with the tongue. That's the reason when tongue is protruded, it will get elevated. So what do? You do incision, and typically including the hyoid bone, you will remove the cyst, which is called Sistrung's operation. Q-SOFA, what does it include? Systolic BP, respiratory rate, Glasgow Coma Scale score, to ultimately predict the prognosis of hospitalization duration. What is the chance a person will require a longer hospitalization? Longer hospitalization is a risk for nosocomial infections, and that can lead to mortality. That's the reason one need to be careful. So SBP less than 100 scores 1 point. That means there is an organ dysfunction. Respiratory rate more than 22 scores 1 point. That shows increased respiratory rate. GCS less than 15 is 1 point with altered mental status. And any Q-SOFA score more than 2 is poor outcome. And Q-SOFA is not diagnostic, it is prognostic. मेरे अब्बा कितने दिन जिएगा बोल के सन पूछ रहे तो इनका पॉकेट खाली. When a patient asks you, till when my daddy dies, by when my daddy died, what does it mean? He has given up, or his wife has given up on father-in-law. Understand? So similarly, if the patient says, I don't want to bother him at this age, that means he doesn't want to spend on him. Right? So these are a few clues we need to pick up as a clinician. Whether to send him home and manage and give him a safe exit, or admit in the hospital. There is a lot of proactiveness in the children needed a lot of times. So now postpartum blue, there is a tearfulness, mood swings, occasional insomnia. 4 days postpartum indicate postpartum blues. So typical onset of postpartum blue is between 2 to 5 days, and it can last up to 2 weeks. 50 to 80% new mothers will suffer from postpartum blues. It is often mild and very self-limiting and resolves spontaneously. Nowadays, they are all what? Nuclear families, nobody to support a delivered mother. Once upon a time, it's all joint families. Delivery is over means after 1 month only, mother need to bother. Somebody or other will catch the child and take care. So, postpartum blue versus postpartum depression versus postpartum psychosis. First onset, 2 to 3 days after delivery is blues. 4 weeks to 6 months is depression. Within days up to weeks is psychosis. Blues resolve in 2 weeks. Depression lasts for months. Then blue is very common, 50 to 80%. Psychosis is very rare, 0.1 to 0.2. Mood swings, tearfulness, irritability, fatigue. Whereas depression may anhedonia. What is anhedonia? The world is ending. Body is becoming zero. I am becoming a hollow man. ऐसे feelings जो होता है ना, anhedonia, guilt. Guilt is the feeling of depression. Did you see cat or dog suffering guilt? No, only human beings suffer guilt. Array, I became late to coming class. Guilt. Right? So I told my patient, డాక్టర్ కొంచెం సేపు కొంచెం ఇంకా కొన్ని మాటలు మీకు చెప్పుకోవాలి డాక్టర్ గారు, కొంచెం 2 నిమిషాలు అంటే ఐ టోల్డ్ if I leave you, I have a guilt I left you without completely listening. If I become late, I have a guilt I could not catch the class. But anyway, you can study. Be mentally prepared to come to the class with an expectation of 1 or 2 hours late arrival of Murli Bharadwaj Express. But take opportunity to read. Ultimately, that is a book. Beyond it, you know, I'm betting, burn all the study material that you have procured till now. What you need is that 700 pages, 10,000 questions, samajhdari ke saath. And you have a support of what online web mein, mbbs.com mein, you have the PowerPoint. All this PowerPoint is there. Intakante em adugadu petted, right? PowerPoint is made available in the online mbbs.com. Not in the app. App we stopped updating it long ago. Right. So PowerPoint will be there. You have got a screen available, and you can, web is more easier. Android ho, kuch bhi ho, you can use it. Right. So postpartum blues, the risk of harm is very low. Whereas self-harm, thoughts of harming infant will be there if it is depression. Psychosis may completely, definite harm will be there for both infant and also the mother. So that is the main difference in exam. Duration. Try to look into duration, look into symptoms. Based on that only examiner will play with you. Postpartum blue or depression or psychosis. Huh? Psychosis can occur anytime. Morning we can propose love, evening we can be psychotic with the boy to mess up his life. So both the things are possible. Next, recurrent episodes of anxiety, palpitation, feeling of impending doom is panic disorder. And what is the first line treatment, doctor? Selective serotonin reuptake inhibitors like fluoxetine, paroxetine, duloxetine. For pain, what is a wonder medicine? Duloxetine. It is available as a brand called Duventa. Duloxetine, lot of diabetic neuropathy pains and different pains people come, no? So there 20 milligram, 30 milligram you can give duloxetine. So duloxetine is basically what? It improves the tolerance to pain by being a selective serotonin reuptake inhibitor. Similarly, behavioral therapy, cognitive behavioral therapy is also very effective to treat the panic disorder. IV mannitol is the treatment for dialysis disequilibrium causing drowsiness and seizures. Because in dialysis disequilibrium, there is a cerebral edema. In the people who undergo dialysis, they develop drowsiness, muscle cramps, new dialysis patients. So mannitol will reduce the cerebral edema. We can also use hypertonic saline oxygen therapy to treat these patients with dialysis disequilibrium syndrome. Diltiazem is used to manage the tachycardia in atrial fibrillation in hyperthyroidism with asthma. With asthma. So, whenever asthma is there, if you happen to give beta blocker, it will affect. So that's the reason diltiazem is preferred. Even among the beta blockers, which is still considered safe for asthma patients, nebivolol, every day we prescribe nebivolol, metoprolol, carvedilol, and these are the common Nebivolol, metoprolol, carvedilol. That's all. Only 3 lols we practice regularly. Metoprolol is available as 25 milligram, 50 milligram. So only 3. Propranolol is still used. Those who have migraine, those who have tachycardia with mitral valve prolapse, and all those people, we use propranolol. Then respiratory distress syndrome. Typically, increased surface tension, decreased compliance are seen in preterm infants who don't have enough amount of surfactant, and chest X-ray shows ground glass opacities. So what is this, doctor? This is the air bronchogram. You can see the air shadow, and this is the, actually after another 4 or 5 students join, we will try to buy a new LCD projector. Until then we'll manage with this. So this is what ground glass opacities. So now, doctor, this is a very important table you need to master. I can also get this print out and give you, but it will be very mortar. Questions లేవు కదా ఇక్కడ. Images తీసేద్దాం. Images తీసేసి only question table చేసినా కూడా 10,000 పేజీలు అవుతుంది. ఏనా అన్ని ఇట్లాంటివే ఉంటాయి. ప్రజలకు ఒక ఎక్స్ప్లెనేషన్ ఉంటుంది. బట్ అదే ఇప్పుడు అదే చేసాం. దిస్ ఈజ్ ఇన్ ల్యాండ్స్కేప్ మోడ్ ఓన్లీ. సో but this is the material which is needed to be mastered for last moment. There is no unnecessary things in this. So anyway, I provided it on the web portal as a PowerPoint for you to view. So respiratory distress. Immediately after the birth, within minutes to hours, they'll have respiratory distress. Meconium ileus develops 24 to 48 hours. Transient tachypnea also within minutes to hours. And neonatal pneumonia within hours to days. Within minutes only 2, respiratory distress and transient tachypnea. It is the surfactant deficiency. That's the reason they are all preterm infants. Meconium is obstruction of intestines by thick meconium. And why meconium? Suppose if the labor got delayed, then the fetus will go into distress. When fetal distress is there, fetal hypoxia is there, then immediately their anal sphincter, everything relax. And that relaxation will lead to release of meconium, which they will aspirate and be born. So typically this is associated with fetal distress history. And transient tachypnea occur in those who have undergone cesarean section, delayed clearance of the fetal lung fluid. Neonatal pneumonia can be bacterial or viral. Then what are the risk factors for respiratory distress? Prematurity, maternal diabetes, C-section, and without labor. Whereas meconium ileus, cystic fibrosis is often associated because it produces thick meconium. Then maternal diabetes, macrosomia, cesarean is associated with transient tachypnea. And premature rupture of membranes, maternal infection, low birth weight are the risk factors for neonatal pneumonia. So there will be retractions, hypoxemia, tachypnea, grunting, nasal flaring, cyanosis in the clinical presentation of respiratory distress. Whereas abdominal distension will be there if it is meconium ileus. And they will also have bilious vomiting, peritonitis. Then coming to transient tachypnea, they will have normal breath sounds, only mild cyanosis. So ground glass opacities, air bronchograms is equal to respiratory distress. Whereas prominent perihilar streaking with the fluid in the interlobar fissures is the feature of transient tachypnea. Whereas pneumonia lead to patchy infiltrates and pleural effusions. And in the case of meconium ileus, if you do abdominal X-ray, there will be dilated loops of bubble, soap bubble appearance in the bowel. I'll set one of the MCQs based on this and then add it in the grand test. So how do you treat respiratory distress? We give CPAP, oxygen therapy and surfactant. Meconium ileus, enema. It is both diagnostic and therapeutic. And transient tachypnea, oxygen, and generally it resolves in 48 to 72 hours. And neonatal pneumonia, we give antibiotics. So this is the quick story of difference. Definitely one question will come. इसमें क्या ध्यान देना है आप? मेकोनियम इलियस का एक्सरे कैसे दिखता, एब्डोमिनल एक्सरे कैसे दिखता, एक्सरे ऑफ hyaline membrane disease, X-ray of transient tachypnea of newborn. Most important, etiology. Finish. Now, next, the squeeze technique is a non-pharmacological management of the premature ejaculation. So, what is squeeze technique? It is a behavioral therapy. So, when the guy is having a temptation to ejaculate, the partner will squeeze the base of the penis just so that because of that nociceptive stimulus, the ejaculation becomes delayed. So, which is called squeeze technique. Similarly, start to stop technique. So, it is like NEETPG day-long classes, breaks. You give break, you give breaks, you give multiple breaks so that you will persist from morning to evening. So start to stop technique also. Honey, it is time to stop. Then we'll take a break and then so that you are delaying the ejaculation. So if the patient doesn't want to take drugs, then first line treatment is the squeeze technique and start and stop technique is what we need to remember. Now, in the hepatitis B management, tenofovir for more than 40 weeks is considered to be appropriate treatment of chronic hepatitis B when there is an elevated SGPT levels. We need to regularly monitor HBV DNA, liver function test, renal function test when you are giving. And tenofovir is also safe in pregnancy. Last week only I admitted one patient of 34 weeks of pregnancy who has got hepatitis B positivity. Yeah, having hepatitis B is not a contraindication to become pregnant. But how do we manage now before delivery? Immunoglobulin and all those things are being administered. So, but she had a raised liver enzymes. So once more, are the raised liver enzymes are due to hepatitis B or is it because of the pregnancy itself? So these are all challenges in managing the patient, right? So what is this, doctor? Tenofovir, which is being given for 40 weeks to treat hepatitis B. Hyperkalemia, whenever elevated serum potassium is there, remember, action potential is decided by sodium. Resting membrane potential decided by potassium. So, elevated serum potassium makes resting membrane potential more positive. Cells become very easily depolarized, making them more excitable. And how does it reflect on ECG? Peak T waves, wide QRS, presence of the sine waves. They are the features. And how do you treat? We need to give calcium gluconate which will stabilize the membrane, insulin, beta 2 agonists, potassium binding resins, etc. So what you need to know, doctor, there will be peaked T waves, small and indiscernible P waves. P wave, which is a sign of atrial depolarization, become small and indiscernible. T become increase. So you can remember, QRS बीच में रहता, उसके सामने आने वाले P कम हो जाता, उसके बाद में आने वाला Q, I mean T, prominent हो जाता, right? हाँ. So you can see tall tented T waves are initially when the hyperkalemia starts. The more severe next stage is flattening of the P wave. Then broadening of the QRS complex. Further potassium increase, it become a sine wave pattern is what we need to understand. Very good. Saurav Kaushik, diuretics also can cure hyperkalemia. Good point. Very good point. So try to get proactive. Proactive, doctor, and keep punching your comments. Hey, I took your advice to move the focus on Instagram. आप Instagram use करते? Oh, so all these days I was foolishly depending on YouTube. So Instagram में every day I launch reels around 70-80 points, which require explanation. So you all like it, share it. Sharing will be there. Like it, share it, so that we will build a big community. You can even share it in your classmate groups, WhatsApp groups, so that more people come to know that we provide a lot of things free in addition to enjoy the joy of teaching, right? So please do. I'm so happy that we have 9 online classmates and you 3 came offline. So tall tented T waves, flattening of P waves, broadening of QRS, sine wave pattern. नींद में भी याद रखना. See, every NEETPG exam, at least 1 or 2 ECGs come. ECG के बिना एक NEETPG पेपर दिखाओ मुझे recent times में. It was morning session or evening session for you? Morning session में 1 ECG will come. Without no paper. 1 heart attack ECG or dyslipidemia ECG. Very predictable. I'm telling you, no. अभी क्या है? What is today? November 12. By December 12, you are a different person. By Jan 12, you are different. By March 12, oh, आप तो तोप बन जाते. तोप. हैदराबाद के भाषा में तोप बन जाते. So that should be the goal. Provided after this session is over, 1 or 2 hours, take time with some friend and do revision. Must, more than enough. So respiratory distress syndrome in newborn occurs due to lecithin deficiency. So what is L/S ratio? L/S ratio more than 2 means mature fetal lungs. Less than 2 means immature fetal lungs. So prematurity, maternal diabetes. Why maternal diabetes? Whenever maternal diabetes is having, mother is having hyperglycemia. All that glucose enter into fetus. That will stimulate fetal insulin. Insulin is antagonistic to surfactant production, whereas glucocorticoids are agonistic to surfactant production. Please remember that rule. So ground glass opacities with aerobronchograms are typically seen. HIV with disseminated histoplasmosis presents with umbilicated papules and multiple bilateral nodular infiltrates. And how do you treat histoplasmosis, doctor? Amphotericin B, liposomal. And for maintenance, we use itraconazole is the treatment. So what do you see here, doctor? You see nodular lesions on the skin. Can you appreciate? Nodular lesions, which is the classical feature of histoplasmosis. Similarly, you can see the cysts of the histoplasma in the lung. So it's a case of diffuse histoplasmosis. Cervical spine injury, which is piercing the dorsal column tract, lead to loss of ipsilateral proprioception in the arm. Ipsilateral arm proprioception. So, what is the function of dorsal column, doctor? It leads to vibration, proprioception, touch, fine touch, sensation. So, they are the things. So, whenever the dorsal column is interrupted, dorsal column does not decussate until it reaches the lower part of the medulla. It won't decussate until it reaches the lower part of the medulla. So in the lower part of the medulla, it's called pyramid. There it undergoes the decussation. You will be there with him because data is there. But still, whereas spinothalamic tract, what it will do, doctor, you can see here. So typically dorsal root ganglion is sensory. Okay. So typically the proprioception bringing fibers will be passing ipsilaterally and reach the lower part of the medulla. So you have nucleus gracilis and nucleus cuneatus. And there they undergo the decussation and go to the opposite side. And they are carried by medial lemniscus. Carried by medial lemniscus. So what is the meaning of a lemniscus? Lemniscus is the path which carries the second order neurons is called lemniscus. So lemniscus, medial lemniscus carried until it reaches the thalamus. What is the importance of thalamus? Greeks called it bedroom. Bedroom is the place where all your sensory wishes are fulfilled. So all sensory pathways invariably need to pass through thalamus. And all motor pathways which are descending down need to pass through pons. Pons is the center of efferentiation. Thalamus is the center of afferentiation, is what you need to remember. So once they reach the thalamus, they go ipsilaterally up and reach the post-central gyrus, which is the sensory cortex. Whereas in the case of the lateral spinothalamic tract, right at the level where they are originating, they will decussate and then pass. Right, doctor? So if let us say left side, half of the spine is injured, pain and temperature on the right side get lost. Okay. Now, herpes simplex encephalitis leads to bilateral lobe, temporal lobe in inflammation on MRI. So this is how you can see, doctor. This is the temporal lobe. This is the temporal lobe. This is the uncus. So here you will find opacification. So right now I have one patient who got admitted, 86-year-old. Altered sensorium is the only presentation. No fever, nothing. Then we did MRI. And temporal lobe inflammation is being found. Then we started him on antiviral treatment. Empirically considering him as as herpes simplex encephalitis. So a lot of times people, fever may not be dramatic, only altered sensorium will be presentation. From there you need to catch the bus. So it shows lymphocytic pleocytosis if you do CSF because it is viral, and bacterial meningitis lead to neutrophilic pleocytosis. Then elevated protein, sometimes RBCs, because it can lead to hemorrhagic encephalitis, herpes simplex. And we give IV acyclovir, which is the drug of choice to reduce the morbidity. And what do you see, doctor, whenever you are having HSV encephalitis? Periodic spike and wave pattern, periodic waves they are called, are the ones which you will typically see. Now, subacute combined degeneration is because of the vitamin B12 deficiency, where there is a loss of proprioception, vibration, and also there is a pyramidal tract involvement, hence upper motor neuron weakness in the lower limbs, like spasticity, Babinski positivity, and lower motor neuron reflexes in upper limbs. So that is because of neuropathy, which is a part of element. Why neuropathy in vitamin B12 deficiency? Because of demyelination. And neuropathy also can cause absent ankle reflexes. So yesterday, ఇప్పుడు బిడ్డ నువ్వు చెప్పకపోయినావు అంటే stand on the bench. What are the 4 conditions that lead to amyotropic lateral sclerosis? 3. Yesterday attend किया class आपने? Oh, come on. मैं आपके लिए वेकेशन भी कैंसिल करके आ रहा हूं. చెప్పాలే ఎఫ్తో వస్తుంది. వెరీ గుడ్. ఇంకొకటి amyotrophic lateral sclerosis, subacute combined degeneration, and Friedreich's ataxia. Good. గుర్తుపెట్టుకోవాలి డాక్టర్. లేకుంటే నేను రోజు అప్పచెప్పించుకోవడానికి ఒక సెషన్ పెడతా, ఒక 1 hour మై ఖాళీ క్వశ్చన్స్ పూछతాము, आप आंसर बोलना. That's a better session. Good session. Rozoka, beforehand only I'll give you what are the 100 questions I'm going to ask. But ting, 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 ting. Catalase positive, staph aureus or streptococcus? Staph is catalase positive. Very good. Methylene blue stain is used for which organism? Metachromatic granules are found in which organism? Corynebacterium diphtheriae. Elongation factor 2 is inhibited by which toxin? Corynebacterium diphtheriae. Satellitism is a phenomena seen in where the organism will only grow surrounding the staphylococcus. What is that? Which organism? Haemophilus influenza. That spardhaya vardhate vidya. Always competitiveness breeds the talent and brings it out. That's the whole purpose. ఇవన్నీ మీరు చదవచ్చు, కానీ you should be inspired to do revision. You need to inspire to contain it. You need to be inspired to present it back. So, do you think it's a good idea? B. Aruna Kumari is saying voice not clear, sir. Manu, check it. Is the voice clear or not clear? Is the voice clear? Can the other online students can punch, is the voice clear? Pakka? Okay. So now, doctor, so do you think it's a good session? Okay, 100 questions is 100 questions మీరు ముందరే ప్రిపేర్ కండి. అంటే I'll only give them randomly, jumbled. Then I will ask questions. In that where that question is being asked, I won't tell you. So రోజు 100 పక్క చదవండి. మస్తు సీట్ వస్తుంది. We'll make it like a Zoom or a Google session where you speak out the answer when I am asking. Like school days లో స్కూల్ పిల్లలు పెడుతున్నారు కదా ఆన్లైన్ క్లాసులు. So a lot of other students also will join across the country. We'll also broadcast it. Full competitive charge straight away. But before only I'll give the points. Slowly we will increase our stamina. इसको भजन प्रोग्राम बोलेंगे. Batkama Batkama Bhuyalo bhajan program, right? Good. Ramesh says voice is clear. Okay. Now, doctor. Harish Rao also is saying voice is clear. I want to know what KTR will say. So now, yes, doctor. Now, diabetic ketoacidosis, what is the initial management? Correct the severe dehydration. Do the airway breathing circulation management. Give normal saline 20 ml per kg and start insulin. Right? So, monitor potassium. Yesterday I told you. What is the effect of diabetic ketoacidosis on total body potassium? High or low? Even though total potassium, body potassium is low, serum potassium will remain normal. Why? DKA leads to dehydration. Dehydration leads to decreased renal plasma flow. Decreased renal plasma flow leads to increased renin-angiotensin. That increases the aldosterone. Aldosterone will cause retention of sodium and loss of potassium into urine. That's the reason there is total body potassium low. But insulin is needed to move that potassium into the cell because that is deficient in DKA. Even though total potassium, body potassium is low, it is not moving intracellular and remaining in plasma. That is the reason your serum potassium value will be normal though the total body potassium is low. The moment you start insulin therapy, all that low potassium will move into the cell and plasma potassium levels will fall down. That's the reason you need to, after the DKA patient is started on the insulin therapy, you need to go back and check his serum potassium after 4 hours and then replenish that. That is the very, very important role. An increase in 25 centimeters in first year is adequate growth. Infant grows 25 centimeters in first year. Birth weight doubles by 5 to 6 months. Birth weight triples by 12 months. Head circumference grows about 12 centimeters in the first year. Average length is 50 centimeters at birth. Most infants reach 75 centimeters by end of first year. And growth slows down to 10 to 12 after the first year. And that is the point. So all developmental milestones today only master, doctor. Tricuspid stenosis may. There is a prominent A wave. I told you why. A wave is because of the atrial contraction during the last 1/3 of the ventricular diastole. During that time, if at all there is any tricuspid stenosis, that will cause the atria to pump with a lot of energy and that lead to a prominent A wave. At the same time, what happens to Y descent? So Y descent is because of movement of the blood from atrium into ventricle. Any stenotic lesion will move it slowly. That's the reason the fall in the pressure in the right atrium will be not drastic, but rather slow. right? Gradually Y descent will fall. And the murmur intensity will increase with inspiration because tricuspid valve is a right-sided valve. Whenever you are taking inspiration, there is a negative intrathoracic pressure which will suck the blood from the body into the heart, into the right side of the heart. That's the reason the right-sided murmurs typically will increase in intensity whenever there is any inspiration. What is that phenomena called, doctor? Caravello sign is what you need to remember. And whenever tricuspid stenosis is there, the blood in the right atrium cannot easily move into the ventricle. So right atrium undergo enlargement, which will be reflecting in ECG as peaked P wave. Peaked P wave. मतलब इसका बड़ा स्टोरी है. You attended the crash course, no? थोड़ा V1 क्या है, V2 क्या है मालूम है ना? I'll tell you. V1 right side. V2, V3 septal. V4, V5, V6. V1, V2, V3, V4, V5, V6. V6 will be there in the lateral aspect. Understand? From right towards the left down will be V6. So where will atrial electrical activity will begin? From SA node in the right atrium. So first right atrium depolarizes, then that goes towards the left atrium. That's the reason typically if you look at the P wave, but there is only single P wave. In this, first half is represented by right atrium, second half by left atrium. The moment there is any right atrial enlargement, what will happen to the, in the V1, first part is right atrial activity and left atrium means it is leaving the V1. That's the reason what will happen, left atrial activity is represented by negative wave. In V1 is located on the right side. So right atrial activity on the right sided lead will cause positive deflection. Electricity chapter. The moment electric charge is leaving any electrode, it will lead to negative deflection. So the left atrial activity will lead to a negative deflection. Whereas in the lead 2, how is the lead 2? Lead 2 is by connecting the right arm with the left leg. గుర్తుపెట్టుకోండి, 3 leads. Lead 1, lead 2, lead 3. Right arm to the left arm, what is that called? Lead 1. Right arm to the left leg is called lead 2. Left arm with the left leg is called lead 3. మళ్ళీ చెప్పండి. Right arm to the left arm is lead 1. Right arm to left leg is lead 2. Left arm to the left leg is lead 3. గుర్తుపెట్టుకుంటారా? So how is our electrical activity of the body? Electrical axis of the heart is passing from right above to left to below, like this. Electrical activity, apex is towards the left. That's the reason in lead 2, if you look in lead 2, the ventricular electrical activity, how is it passing? From above to below, right to left. That's the reason it will be represented by a positive wave. That means R wave will be positive, which represents the ventricular electrical activity. Ventricular electrical activity represented by QRS and D. Q is negative wave before R is the positive wave, and any negative wave after the R wave is called S wave. So it is the R wave which is prominent in lead 2. Lead 2, because that represents what? Electrical activity of the axis of the heart. Similarly, if you look at the atrial activity, P wave, your right atrial activity is starting on the right side, and the electrical activity is going towards the left, because lead 2 is also going towards the left. So there will be no negativity because of the left atrial activity, right? So it will be represented by a single P wave. The initial part of this is right atrial, the later part is left atrial activity, whereas V1 is purely right sided lead. Hence, right atrial activity is represented by initial positive wave, and the left atrial activity is it is leaving the V1. That is the reason it will be a negativity. Clear? Very simple. So, ఏం పాయింట్స్ ఉంటాయి అంతే, ఇదే పాయింట్. రైట్ ఏట్రల్ ఎన్లార్జ్మెంట్ ఉంది అనుకోండి, దిస్ ఇనిషియల్ రైట్ ఏట్రల్ యాక్టివిటీ బికమ్ వెరీ ప్రామినెంట్. ఆల్రెడీ ఇట్ ఈస్ superimposed on left atrial activity leading to single wave. The moment right atrial activity is more with right atrial enlargement, it all will represent as single wave, which is prominent. Whereas in the lead V1, initially it is as positive as negative. Right atrial activity and left atrial activity equal. That's the reason this positive wave equal to negativity of the negative wave. But right atrial enlargement will cause this to become sharply peaked while still maintaining that little negativity. Suppose left atrial enlargement is there, then what will happen? Earlier right and left atria are able to accommodate in single P wave, but that P wave become broadened and show two bumps. One bump is right atrial activity. The second bump is left atrial activity because of the left atrial enlargement, and this is called P mitral. Enduku? First it looks like M shape, and it is because of the left atrial enlargement. Left atrial enlargement is commonly because of mitral stenosis. That's the reason it is called P mitral is M-shaped wave. In which lead? Lead 2. Where normally you find only one single P wave. That become broadened and right atrial and left atrial activities get separated. Then what will happen in left atrial enlargement? Typically in left atrial enlargement, normally in B1, the positivity of the RA and the negativity of the LA will be equal. But here, the positivity of RA remains the same. The negativity become more prominent. That is left atrial enlargement. ఏం లేదు, V1 ఈడు ఉంటుంది, లీడ్ టు అటు పోతుంటుంది అని తెలిస్తే చాలు. ఫస్ట్ ఇక్కడ రైట్ ఏట్రల్ యాక్టివిటీ ఉంటుంది, ఇటు లెఫ్ట్ ఏట్రల్ యాక్టివిటీ. సింపుల్. హౌ డు యూ క్యాలిక్యులేట్ హార్ట్ రేట్? Between two R waves. If it is very high heart rate, 1500 divided by small boxes. So how did we arrive that calculation? అరే మీరు ఇట్లా చక్కమని 1 minute లో చెప్పాలి. Each small box is equal to 1 mm. Agree? And what is the speed of the heart? 25 mm is equal to 1 second. And 1 minute is equal to 60 seconds. 60 into 25 is equal to 1500. So 1500 mm is equal to 1 minute. Agree? So if you take the small boxes into consideration, 1500 become numerator. But if you take large boxes into consideration, since 5 small boxes make one large box width is 5 mm. So 1500 divided by 5, that is 300 large boxes will make 1 minute. Hence you are using large boxes criteria, numerator become 300. Confusion దీంట్లో? ఈవెన్ నిద్రలో లేపినా కూడా చెప్పాలి ఇది. ఈ స్మాల్ బాక్స్ 1 mm, 25 mm is equal to 1 second, and 1 minute is equal to 60 seconds. That means 25 into 60 is equal to 1500 mm is equal to 1 minute. That's the reason we are calculating heart rate per minute. That's the reason between two QRS complexes, the number of small boxes we calculate, and 1500 divided by that many number of small boxes is equal to heart rate per minute. If you take large box, since each large box is 5 mm, 5 small boxes. Agreed? 5 mm. So one large box is equal to 5 seconds. Each mm is equal to second together. So 5 seconds. Each large box is equal to 5 seconds. Avuna kada? So not 5 seconds. Sorry. Intavaraku vachindi kada. 1 mm is equal to 1 second. So 60 seconds is equal to 1500 mm. And if it is large box, each large box is equal to 5 mm. That's the reason 1500 by 5 is equal to 300 become the numerator. Okay. So now you look at this, doctor. How is lead 2 made before QRS? How is the P wave? Before QRS, this is QRS, this is P wave. How is the P wave? Huh? Right atrial enlargement. That's the reason it will be prominent, no? I told no. First is right atrium, next is left atrium. Normally together become single P wave. And whenever the right atrial enlargement is there, it become a more prominent P wave in lead to. This is ఎట్లా అవుతుందన్నా లెఫ్ట్ ఏట్రల్ ఎన్లార్జ్మెంట్ లో నీకేం చెప్పాను? It gets separated, no? This is right atrium, this becomes left atrium. So left atrial enlargement lo P mitral will appear in lead 2. Right atrial enlargement lo prominent P wave like this will appear in lead 2. Normal people lo only a P wave will be there. Any confusion? Agreed? Then if you go to, okay, lead 1 is, V1 is not there. See, right atrial enlargement in lead V1 will be prominent initial positivity, and left atrial enlargement will be prominent negative deflection later on in lead V1, V1 being right sided lead. Okay, malla avudam le chaala saarlu vastadi idi. So good. Harish says clear, sir. Oh, I mean, is the concept clear or what is it, Harish? Now, congenital rubella syndrome typically lead to deafness, cataract, and PDA in the newborn. Deafness, cataract, and PDA. PDA lead to machinery, remember. And even pulmonic stenosis, septal defects can occur in the congenital rubella. But remember, cataract, deafness, PDA. Deafness is sensorineural deafness. Then vitamin B deficiency. So vitamin B12 is very predominant in rice and pulse diets. And the diets low in animal products common among the vegetarians lead to vitamin B12 deficiency. In cystic fibrosis, what happens to the chloride level in the sweat? Typically, it will be increased more than 60 millimoles per liter. Normal may, otherwise, normal people may less than 30. So 30 to 59 is called intermediate, and 40 to 59 is called, also called intermediate. More than 60 is definitive. Then in the measles, what do you get? Fever and rash spreading from the face to body and Koplik spots. They are the pathognomonic feature. So what are the 3 C's which are called the triad of features in measles? Fever, cough and coryza. High fever, cough, coryza and conjunctivitis. High grade fever, cough, coryza and conjunctivitis. When will rash appear, doctor? 3 to 5 days after the initial symptoms. It is maculopapular. And how is measles transmitted? Respiratory droplets. And we use the MMR vaccine. It is very much effective for prevention. So it is given at 12 to 15 months and again at 4 to 6 years. And for how long you want to isolate the kid who got measles? For 4 days after the rash onset. For 4 days after the onset of the rash. So what is this, doctor? This is called Koplik spots, which are seen in the case of the measles. Blood pressure tracking means what? 20-25 years ko hi 140-150 maintain kar rahe to when they become adult also they will show hypertension. That's called tracking. Blood pressure levels in childhood will predict the adult blood pressure levels. Is what we should is called tracking phenomena. Azithromycin is the one which is prescribed to an infant who has got paroxysmal cough followed by apnea, that is oofing, with high WBC count. So azithromycin is a macrolide, very effective on Bordetella pertussis, which is the causative organism. Asha, what are her roles if you don't know? NEETPG results will be Nirasha. So Asha is your Asha to get into MD Gynops. So Asha provide health education, counseling to pregnant women. They advise on safe, nutritious food, importance of fruits and vitamins, and common myths. Papaya खाए तो abortion होगा, pineapple खाए तो baby will be like pineapple color. All that myth को remove करना, right? So as a MBBS student, when I used to attend, sit in the Gynops OP, so many questions they ask. కొత్తిమీర తింటే ఏమైతే డాక్టర్, కరివేపాకు తింటే ఏమైతే డాక్టర్, చికెన్ సూప్ తాగొచ్చా డాక్టర్? So they won't be written in your Shah and Datta. But you need to, so I used to come back and ask my grandma as to give me the list of things to okay and not okay. So some myths even my grandma used to have. So that's the point. So cervical erosion. Yellow kit should be used to a patient with minimal vaginal discharge and cervical erosion coming to the STD clinic. So National AIDS Control Program for treating cervicitis and vaginitis. So what are the contents of yellow kit? It contains azithromycin 1 gram single dose and secnidazole 2 grams single dose. And yellow kit may available azithromycin secnidazole will help chlamydial infections, trichomoniasis and other cervicitis. It is designed for single dose therapy, improving adherence and treatment completion. So doctor, this is one important thing. You have different kinds of kits. When urethral discharge is there, gray color kit. Cervical discharge is there, azithromycin plus secnidazole. Then painful scrotal swelling is there, azithromycin and cefixime. Then vaginal discharge is there, secnidazole and fluconazole. Similarly, you have a white kit, blue kit, red kit. I leave the literature for you. Somehow you try to remember because these are important in community. Similarly, you have a yellow kit and also black kit. Now, what is YPLL? Years of potential life lost. If you count that, our MBBS 6 years, 3 years, MD 1 year preparation, 10 साल हमारा जिंदगी बर्बाद. अगर हम 100 साल जिए तो भी 90 साल के समान है. So, but that is not true. The whole joy is now. आराम से कुछ भी टेंशन नहीं है. प्रिपेयर होना, खाना, मूवीज देखना, दोस्तों के साथ आइश करना. दिस इज द हैप्पीएस्ट टाइम. बाद में शादी करो, हाफ बर्बाद. पीजी करो, दूसरा हाफ बर्बाद. So how do you calculate age and death from a standard age? For example, India में expected life expectancy 75. Somebody died at 50 years. 25 years is the years of potential life lost is what you need to remember. Now, TT and TD is given in as a part of the school immunization program for 10-year-old children. TT by TD vaccine is administered to 10-year-old children, and there is a booster dose. It acts like a booster dose, reinforcing the immunity. And a TD booster is recommended for 16 years, at 16 years, so it will provide a prolonged protection. And lifelong immunization, every 10 साल को एक बार TD booster डालना पड़ता. Now, so when we are in clinical practice, every 5 years or so, we need to renew our practice certificate. After permanent registration. So I asked local state register people. Every time उसको एक 2000 रिश्वत देना पड़ता जल्दी देने के लिए और 2000 फी पे करना पड़ता. So it's like a TT, immunization booster regularly. So tympanic branch of the glossopharyngeal nerve lead to referred ear pain. And what is the other name given for this branch of the glossopharyngeal? Jacob's nerve, which supplies the middle ear. So this is very important thing that you need to learn, doctor. You have glossopharyngeal nerve. It gives one tympanic branch. Tympanic branch here, which is passing into pharyngotympanic tube. Here there is a tympanic plexus. From that comes the lesser petrosal nerve, which will go and merge with otic ganglion. From that will be dangling down auriculotemporal nerve, which goes and supplies the parotid gland. ये रास्ता मालूम होना. और एक बार बोलो. Glossopharyngeal, tympanic branch, tympanic plexus, auriculotemporal nerve supplying the secretomotor fibers to parotid gland. Then there is also a communication with the vagus nerve, and ultimately glossopharyngeal comes and supplies stylopharyngeus. Right? Stylopharyngeus. Then it also drops a branch which is called carotid sinus nerve, which will go and supply the carotid body. Carotid body. So whenever the blood pressure increases, The carotid body से fibers जाके inform करेगा किसको? Glossopharyngeal. And in turn the efferent will pass through the communicating branch to vagus, and which supplies the heart. So that's how our blood pressure is sensed in the carotid sinus, and accordingly the heart will respond back. So afferent is glossopharyngeal, efferent is vagus in this pathway. Okay. Then also the glossopharyngeal goes and supplies the posterior 1/3 of the tongue. Anterior 2/3 of the tongue taste is by chordotympani division of the facial nerve. Posterior 1/3 is by glossopharyngeal nerve, is what we need to remember. It also gives sensory branches on the middle constrictor muscle, right, in the pharynx. And also it supplies stylopharyngeus. Now, what is Colombo plan? Economic social development in Asia Pacific regions, including setting up of cobalt therapy units to enhance the cancer treatment, cobalt 60 radiation for treating various cancers. It is all done under Colombo plan. Beta-oxalyl aminoalanine, BOVA, typically Lathyrus sativus, called chickpea, commonly consumed in rural areas. It leads to neurolathyrism. What do you find that? What do you see in that? Spastic paraparesis, upper motor neuron paralysis, progressive weakness, guide disturbances, etc., etc. Now, once more, TD booster is generally recommended every 10 years. 2023 NEETPG means और 10 साल तक टेटनस के ऊपर क्वेश्चन डेफिनेटली आएगा. टेटनस रेबीज पिच्छी जब्बुल अవి. We have to remember, there is no other way that you can say. Classification of the danger of the wound in rabies should develop some funny way in a group discussion, right? So two things, doctor, always remember. The quantum of the knowledge that you should understand and the quantum of the knowledge that you need to reproduce. For reproduction of the knowledge, you require memory, which is fortunately given equally to everyone, unless we suffer some disorders. Second is emotional quotient. Entrances are all what? Obsession to win, insecurity to live without ending. That should prevail strong in our heart. So my job is to induce that sense of competitiveness and a restlessness and hustling inside your heart. I'll try my best to do that, but I may spoil you if I teach everything. There's very little to teach. There's a lot to read. Some concepts require clarity. Agree? So what you need to revise, you need to make ready every day. Okay, collection of 150 points which need to be revised, you need to identify every day. 150 into 60 days preparation, 9,000 points are there in your pocket that you plan to revise and also keep regularly revising. Few concepts, not more than 1,000 concepts to understand. अंडरस्टैंड करके समझ के चालू हो के एग्जाम में शहंशाह बनने का उतना नहीं है सीन पीजी एंट्रेंस के लिए. 1000 पॉइंट्स को renal tuberous acidosis type 4 में why there is a hyperkalemia, why do we give in diabetes insipidus, thiazide diuretic, even though it is a diuretic, and diabetes insipidus also is a diuretic condition. Why there will be nephrocalcinosis in barter. So such concepts, those things require understanding. Remaining is all sphingomyelinase, which condition, hexosaminidase, which condition, hepatosplenomegaly will be there in this condition, but not that condition. Abba. This is not called intelligence. This is called as being sensitive, conscious to become the winner. Okay? So, never ever belittle your own memory. Rule of the game. मैं भूल जाता हूँ, अगर 2-5 बार आप मैं भूल जाता हूँ बोल के सोचे तो भूल जाते. Second, क्यों? If you do MRI, all aspirants have same MRI. Only their adrenal thickness is different. The one who made it in internship only 23rd rank, that person right from first year MBBS is thinking, I won't stop with MBBS. I need to become a winner when I become MD. By becoming MD. No problem. But in the process, that person might have lost a lot of beauty things that we all enjoy. But now, if we sit, hamara number aayega. 4 mahine. Okay? So make it that a point, doctor. So, how do you collect the water? Water collected from a gentle stream to avoid splashing whenever you are doing the bacterial examination during the disease outbreak. And keep the sample cool 4 degrees Celsius if immediate transport is not possible to preserve the bacterial viability. So these are the precautions in collecting the water during disease outbreaks. See, this kind of questions which came, for example, in NEETPG 2023, next 100 साल तक पूछेगा नहीं, right? But these are the things which will create that intimidation in the exam. And remember, out of 200 questions, 50 questions to 40 questions will be of this nature. Remaining 150, sure start. सर्वाइकल कैंसर होना है तो होता, ब्रेस्ट कैंसर होना है तो होता, कोई रुकता नहीं उनका पोजीशन को. कॉन्ट्रासेप्शन के ऊपर एक क्वेश्चन होता, इनफर्टिलिटी के ऊपर एक क्वेश्चन होता, स्ट्रेप्टोकोकस स्टेफिलोकोकस के ऊपर एक रहता, नेफ्रॉन फिजियोलॉजी एक होता, ग्लोमेरुलोनेफ्राइटिस एक होता, एपोप्टोसिस एक होता, एचआईवी ड्रग्स एक होता. 150 स्टैंडर्ड, नो वन कैन स्टॉप इट. 50 क्वेश्चन क्रेजी क्वेश्चन. पानी को हिला के लगाना, नहीं तो नहीं हिलना, नहीं तो स्ट्रीम से पकड़ना, to collect a sample. Collect the water from gentle stream to avoid splashing for bacteriological examination during a disease outbreak. So during the disease outbreak, the original question was, how do you collect the water? Was the MCQ in 2023 NEETPG. You can't help it. Right? Now, whenever there is any varicella, what is varicella? Varicella is the chicken pox. Isolate for 6 days after giving acyclovir whenever you are suspecting varicella in a hostile outbreak. 6 दिन उसको बाजू बिठाना after the rash onset. And acyclovir is recommended within 24 hours after the onset of the chickenpox rash. Chickenpox in childhood become reactivated in older age. But if somebody did not get chickenpox in childhood also, can get severe chickenpox when they go to medical college. So whenever in a hostel, किसी बंदे को chickenpox आ गया तो you need to isolate him for 6 days is what you need to remember. And varicella vaccine within 3 to 5 days of exposure to somebody with chickenpox will reduce the severity in the exposed person. That is the post-exposure prophylaxis. For example, you are a medical student, you never got chickenpox in childhood. Suddenly you got exposure to a patient who has got chickenpox. Then you can get it, take a vaccine within 3 to 5 days of exposure. Now, diabetes insipidus. Whenever pituitary is resected, post-hypophysectomy, it will lead to central diabetes insipidus or peripheral? Central. So there, is it posterior pituitary or anterior pituitary where ADH is produced? There is no slight pregnancy, only pregnancy. Posterior, what are the two hormones? And ADH. Huh? So, and is ADH really produced in posterior pituitary? Here it is a storage. So, lifelong supplementation you need to give. And this desmopressin is available as a nasal spray, oral tablets, and injectable forms. And where does it bind? It binds to V2 receptors in the kidney, increasing the water reabsorption. Acute pain and swelling of the great toe with raised leukocytes, such as gout. Big toe metatarsal joint is gout. When you start clinical practice, first gout case comes, you are lucky guy. Abba, pain doctor, along with that another 10 attendants come. Open his mouth and put one ibuprofen. Ask him to sit outside, drink water. He's relieved. Abba, thank you doctor. You're divine Hemant Swamiji. Hemantanand. So, colchicine, corticosteroids are indicated if the NSAIDs are contraindicated. Among the NSAIDs, indomethacin is used in acute gout. Never use allopurinol in acute gout. Allopurinol is only used in chronic gout. Allopurinol is the inhibitor of? Inhibitor of which enzyme? Tell me one more drug which is the inhibitor of xanthine oxidase. पढ़ के आना नहीं तो रैगिंग करेंगे. Febuxostat. देखो. Hemant is ఒక ఫోటోగ్రాఫ్ తీసుకోపా హేమంత్ ది మళ్ళా సీట్ వచ్చినాక తప్పించుకుంటాడు. So good. Now coming to Wernicke encephalopathy. What is the classic triad of Wernicke encephalopathy? Confusion, ataxia, ophthalmoplegia is the classic triad. Confusion, ataxia, and ophthalmoplegia. Painful ophthalmoplegia. Movement of the eye will be painful because the involvement of the abducens. There will be a lateral rectal palsy because the lateral rectus, abduction get affected. There will be diplopia. एक दो दिखता है. So इसके वजह से ataxia, चलने में दिक्कत होता है. There will be nystagmus, gaze palsy, and you treat with IV thiamine. And if you do MRI, where do you find hyperintensity, doctor? Mammillary bodies and periaqueductal gray. Now, whenever digoxin toxicity is there, wait for 80 hours. Do we have any case? Wait for 80 hours before resuming the digoxin treatment. Right? What is the optimal digoxin levels, doctor? Serum levels? 0.5 to 2 nanograms per ml. Please don't forget, favorite question of the examiner. Any concentration more than 2 nanograms is considered to be toxic, and more than 4 nanograms is severely elevated. And whenever digoxin toxicity occurs, predominantly the side effects will not be in the heart. They will be there in the gut. That's the reason nausea, vomiting, vision change. What kind of vision change? Yellow color of the vision. Xanthochromia will be there. And what kind of arrhythmias digoxin will cause? Yesterday I told. PATs. Paroxysmal atrial tachycardias will be there. So once toxic effects appear, don't give the digoxin tablet until the next 80 hours. You need to full stop it. And how do you treat digoxin toxicity? Always remember, hypokalemia predisposes to digoxin toxicity. But digoxin toxicity leads to hyperkalemia. Hypokalemia leads to digoxin toxicity. But digoxin toxicity will cause hyperkalemia. Why? Because digoxin basically acts by inhibiting a sodium potassium pump channel, right? So because of that, too much of digoxin will cause potassium to not move into the cell, leading to development of hyperkalemia. Am I too fast? Mari ade ante petrol khatam 1 hour 30 minutes no. Okay, time la my voice become music and you stop understanding it. मैंने मतलब मम्मल आपको हिलाना पड़ता. Generally also our attentions came down. మనకి ఏదో మధ్యలో ఏదో థాట్ వస్తుంది, అది ఆలోచిస్తూ ఉంటాము, ఇక్కడేమో నడుస్తూ ఉంటుంది సోది. Right? Sometimes I suffer also that, remembering something else while teaching, but still I continue to teach because of the long habit. ఇప్పుడు అర్థమైందా లేదా మీకు చెప్పండి. డిగాక్సిన్ టాక్సిటీ ఉంటే పొటాషియం పెరుగుతుంది, కానీ పొటాషియం తక్కువ ఉంటే డిగాక్సిన్ టాక్సిటీ వస్తుంది. Hypokalemia predisposed to digoxin toxicity, but digoxin toxicity leads to hyperkalemia. Will you remember this? खाली remember ने reading room में it is a missile for you. अच्छा ये भी मालूम नहीं? Why are you going to that coaching program? Come to Murli Bharadwaj sir. थोड़ा आप मेरा marketing करना पड़ता बेटे नमीरा. तो they will ask, is it 70,000 package or 1 lakh package for live class? Is it on weekends? No, it is daily. जब तक सार को टाइम पास नहीं होता आके पढ़ाते. 4,000 में आपको मिल जाता. बोल के बोल देना, हमको भी टाइम पास नहीं हो रहा, आपको भी टाइम पास हो रहा, आना. So when I was preparing for entrance, when I started coaching, around 200 students used to attend from Usmania, Gandhi and Shadan. So an income tax officer came with his daughter. So my father used to be there. He's a retired officer in LIC. So he asked, how much is the fee, sir? My father said 1,000 rupees. Oh, 1,000 for, yeah, there is no for, he said. So, I mean, it is for, then, okay, either your daughter gets seat first or my son gets seat first. Whoever gets seat first, until then, fees is 1,000 only, once you pay now. So he got totally surprised. That girl, Aparna, she got MS General Surgery way back in, I'm talking about 2000. Maybe I don't know whether you are born or not. So 2-3 classmates जिसको time pass नहीं हो रहे, उसके साथ बैठे तो coaching आगे, I mean, you don't need coaching also, आगे बढ़ता preparation. I'm one of those no time pass geriatric teacher who is pioneer in spending time with you guys. Read every day. Huh? छोटे चीजें. See, for example, digoxin level more than 2. Very fast we will forget it. But 2-3 times, digoxin level important, lithium level important. Lithium digoxin, इसका actual values पूछते examiner. ठीक है? Now doctor. So check digoxin level, potassium level, renal function test. These are the 3 things you need to do. Why potassium level? Because digoxin toxicity can lead to severe hyperkalemia is what you need to remember. So what is this, doctor? In the ECG, whenever a patient is taking digoxin, the ST will show a curved ST segment depression. This is the curved ST segment. See, this is the T wave. देखो बेटा, ये T wave. ये क्या है? QRS. So between the S and the T wave, beginning is called ST segment, and that will be sagging down. So what is it looks like? Salvador Dali is a Spanish fanatic, very popular for his mustache, which is curved. Salvador Dali's mustache. Otherwise, this is called as reverse stick sign. Scooped ST, otherwise called hockey stick sign. They are the various names given for digoxin toxicity. Now coming to atropine toxicity. Atropine is an antagonist to acetylcholine. So that lead to rise of the temperature, skin become dry, tachycardia, delirium, etc., etc. So dry mouth, blurred vision, flushing, blurred vision because pupillary dilatation occur, mydriasis occur with atropine, meiosis will occur with OP poisoning. Yesterday we discussed. There is also urinary retention. Acetylcholine stimulates the bladder, relaxes the sphincter, whereas atropine will relax the bladder, constricts the sphincter. That's what you need to remember. Tissue plasminogen activator, it will increase the degradation of the fibrin. So it is best if you give it within 3 to 4.5 hours. Major effect of any thrombolytic agent is what? Bleeding. So that's the reason whenever a patient comes with weakness of the limb, first investigation to evaluate stroke is non-contrast CT. You know, right? If you do non-contrast, why do you do? Hemorrhagic bleed or ischemic bleed? Ischemic stroke. Only if it is ischemic stroke, you will give thrombolytic agent. So one of the patient, top neurologist, one of my senior, so उसको ischemic stroke आए तो बहुत कन्विंस करके thrombolytic दिया, वो hemorrhagic stroke बन गया इतना बड़ा. So all the patient attendants went, my brother is all right, but after you have given that injection, he became like that. So he gave a call and said, Murli, these fellows are becoming unruly, so I am shifting under your care. So the patient was shifted under my care. So that is the strategy, so that patient attendants will accept. Always what we think, that coaching is better than this coaching. That material is better than this material. Right? So they came, so I convinced them, I explained them the entire neuroanatomy. Doctor, that doctor is not knowledgeable. You are knowledgeable. I told he did DM neurology course. My senior, and उसका नसीब टूट गया है, इसलिए वो रेगुलर देने वाला थ्रोम्बोलाइटिक दिए तो ये हेमरेजिक बन गया. कन्वर्ट అయిపోతుంది, అయిపోయి ఫుల్ బ్లీడ్ అయ్యి ఫుల్లీ స్పాటర్డ్. And he got intubated, and in ambulance he pushed it to us. So all doctors are a mafia one way. That's the reason never badmouth another doctor. That is a rule. Because mishappenings happen to anybody. If we end up in bad mouthing the other person, that's no good. That won't help. Tomorrow, if your patient bleeds, he is the rescue. Because we can't predict which patient bleeds, right? So that's the point. Now, Asherman syndrome, hysteroscopy is preferably done in Asherman syndrome. So what is Asherman syndrome? Whenever you do dilatation, curettage for miscarriages or endometrial procedures that lead to adhesions which will prevent implantation of the fertilized ovum, that can lead to infertility. So evaluate by doing hysterosalpingography, hysterography. And how do you treat that? You need to break, adhesionolysis need to be done. And you need to place an intrauterine device to prevent the reformation of adhesions is what you need to remember. So if you do hysteroscopy, पूरा cobwebs के जैसे दिखता यूट्रस के अंदर. आपको टाइम मिले तो एक बार यूट्यूब में जाके Asherman syndrome adhesions in uterus बोल के hysteroscopy के लिए चेक करो. Nice. Some gynecologist might have put fundus. Now, iron supplement should be started within 8 to 10 weeks of pregnancy for primigravida who is having anemia. So what is the recommended dose? 30 to 60 mg of elemental iron for pregnant women. And the iron supplement, typically we need to target hemoglobin level to be more than 11. Then for cervical cancer management, what do you give? Chemoradiation is the one which is indicated for the management of a stage 2B. So why do you call that a stage 2B? Because lateral parametrial involvement comes under 2B. The moment parametrium is involved, surgery alone is insufficient. You need to give chemoradiation. What is the most common cause of death in cervical cancer? Renal failure. Because in the parametrium, very close to parametrium, ureter will be passing. So whenever it is invading the parametrium, it will compress the ureter, leading to obstructive uropathy, leading to development of uremia, which will ultimately kill the patient who has got cervical cancer. So the treatment of chemoradiation is 5 to 8 weeks, and it includes both external and internal radiation. Now coming to genital tuberculosis. How does it present? Lower abdominal pain, minimal discharge, intermenstrual bleeding is the presentation. Intermenstrual bleeding is the presentation. Most common location of the genitourinary system to get involved in TB is fallopian tubes are the most common, followed by endometrium. Now, this is how, doctor, you can see this is called lead pipe appearance. Lead pipe appearance of the fallopian tube if you do hysterosalpingography in case of genital tuberculosis. So, mere pyare yaro, with this we will conclude the today's session. Slowly increase our stamina for 3 hours, 4 hours. Okay. So tomorrow morning we'll continue. Once more, Sunday, Monday is test and discussion. Tomorrow we'll try to aim to finish 100 PYQs. And Mitrama. So thanks to all the online students. And we will all meet tomorrow. And I'll keep posting some videos on the Instagram, and also PowerPoint get uploaded into the onlinemmbbs.com video library. So let us slowly become better.